With the announcement of the first confirmed case here in the capital, health officials explained today that managing the virus will mean proper health management and protocols coupled with personal responsibility.
The Bahamas today confirmed its first case of COVID-19 here in New Providence.
The news person suspected would only be a matter of time before the novel coronavirus made it to Bahamian shores. Acting Minister of Health, the Honorable Jeffrey Lloyd, gave these details about the victim during a live press conference Sunday.
The patient is a 61-year-old female resident of New Providence who does not have a relevant travel history. She presented with symptoms of fever and cough. She is not known to have traveled outside of the country in the past 20 days. And at this time, the patient's exposure is unknown.
Minister Lloyd said the victim's family members have been advised of the diagnosis and that she is receiving treatment in a designated isolation area of the Princess Margaret Hospital. Consultant Physician of Infectious Diseases at PMH, Dr. Nakia Forbes, gave this timeline associated with the first case.
The patient presented to the Princess Margaret late on Friday evening. She would have been tested the following morning. There are batches for testing. As soon as we had the results available, that was just after midnight tonight.
Chief Medical Officer Dr. Pearl Macmillan spoke to the patient's nationality.
To my understanding, she is Bahamian. Family will be a part of our contact tracing investigation. As required, we would go ahead and do necessary testing.
When pressed on why the information was not announced sooner, this was Macmillan's response.
And I would say this. Certainly, you get a positive, and then you retest. That's another 4 or 6 hours to confirm that that is positive, and then you may wish to do another one. And in this case, we did, I think, 2 iterations of testing to ensure that we are telling you and we are telling the patient that they are positive.
Well, health officials report that there are 100 COVID-19 test kits on hand. 8 persons have been tested so far, and up to yesterday, there were 10 people in quarantine. Meantime, there is an important term that you should become familiar with in the days ahead: contact tracing. Health officials were asked today about what that process entails.
In order to find out who the contacts are and how many there are, you have to actually ask those questions. So the investigation is ongoing with both the patient and the family to find out who all those people are. So as you contact individuals and you find out they were in contact with an individual, then you can say, okay, well, these people or this person now needs to be quarantined. You can't do that ahead of time to say all of this person's family needs to be quarantined because 1, you don't know who all the family are. 2, you don't know where they are.
Dr. Brennan details how health officials will go about identifying other suspected cases.
So what we're doing actively is we have our entire team mobilizing to do exactly that work. So while we find out there are a number of contacts with the individual, then we spread out and we get those. Then we find out from them who else may have been contacts, and then we get in contact with them, and we will cast our net as wide as we can and start pulling people in. Some of that obviously will start with self-quarantine and moving people into their homes and keeping them away from others. But if it's found that we are unable to do that effectively by having people do it all on their own, then we may have to move to moving them into a quarantine facility until we can be sure that they are self-isolating and not able to then transmit it to others.